Hello, everyone, and welcome to 3 Steps to Mastering Your Feminine Cycle, what every woman needs to know, and the things that I wished I had known when I was growing up. So we have a lot of material to cover today, so I'm going to try to keep this moving at a pretty rapid pace. So today what we're going to be talking about is the 3 steps to mastering your feminine cycle. And what I mean by that is the menstrual cycle, the fertility cycle, and kind of the bigger picture beyond that too, living in harmony with your body in both lifestyle and also in things like with your fertility and birth control and this type of stuff. So today what we're going to be doing is we're going to be laying the foundation. So this is going to be kind of like filling in the gaps of your information. I know all of us know lots of different things about our bodies, but what I find when I have conversation with women is there's always something that they're like, oh gosh, I didn't know that, wow, that's amazing. And so that's what today is about. It's about filling in the gaps of information. We're going to dive in really deep with the female biology. We're going to go way beyond anything that you ever got in your biology class in high school or sex ed or that kind of thing. You're going to learn some really cool things. These are, some of my favorite things to teach about. And so today, like I said, we're going to have a lot of information to cover. It's going to cover a wide variety of topics, all having to do with the female cycle. And the second step in mastering your cycle is learning the tools that, for people who, for example, want to use a natural approach to different things, like, for example, say, birth control. They want to use a natural approach rather than rely on hormonal birth control, or maybe they are having problems with HPV and would like a natural approach to address those kinds of issues. So when I talk about your toolbox, it's like these types of tools, like the techniques that would help a woman learn, to identify when she's fertile and know when it's safe to have unprotected sex, or in the case of like a HPV infection, what you can do to boost your immune system, different herbs you can use, and with the goal of trying to get rid of the virus, which at this time, there is confusion in the medical research community establishment as to whether or not we can clear the virus. And that's actually a topic for a different day. We're not going to go into that today. We will touch on HPV a little bit, but we're mostly going to be focused on the female body, the cycle, our erogenous zones, our erectile tissue. So we're going to go in that direction today. So, but I did want to let you know what steps 2 and 3 are, because once you have the foundation of information, then you get to decide what path is the right path forward for you. And if you want to learn about natural birth control methods, then I'm going to get it together again on July 2nd, and we're going to do a big workshop. It's probably going to be about 3 hours long, and I'll teach all of the different birth control methods that there are, with a focus on the more natural ones like the fertility awareness methods, and then also I'd like to talk a little bit about herbs and how they can be used to influence fertility too. So that's just something that I've had a lot of interest in over the years and have collected quite a bit of information about that. So, even if it's not something that you're going to go and do necessarily, it's really fun to learn about, and I do know people who have used herbal contraceptives to manage their fertility. And it's tricky. You need to learn, the basics, like the foundation stuff that we're going to be learning today. And then also, in my opinion, it's good to know the fertility awareness techniques too. So today, like I said, we're going to focus on the foundation. And then step 2 will be learning the tools. And then step 3 is implementing what you've learned. Some of this stuff is going to be changes to your lifestyle and that kind of thing. And so that's probably something that you might do on your own, or if you want support, we can do that too. So let's get started. I'd like to introduce myself just very quickly. My name is Robin LaCrosse. I'm a holistic health practitioner who specializes in women's reproductive health. I'm also a holistic sex educator. I've been teaching natural birth control methods, including fertility awareness, for over 25 years. And I have a lot of other skills and interests and that kind of stuff. I'm a coach. I'm an herbalist. I'm a photographer. You know, I have a cute little adorable puppy who's sitting here next to me, and hopefully she will be nice and quiet and sleep through the whole presentation. That's my hope. Let's dive right into the anatomy. Some of this you're going to recognize, and then there's probably going to be some things here that you maybe didn't know about or maybe heard of but didn't know where they were located, you know, that type of thing. So you will be seeing pictures of female anatomy. Most of them are just diagrams. So let's just start with the basics, okay? I mean, everybody knows that we have ovaries. So if you're looking here in the picture, the ovaries are in the top. So here are the ovaries are kind of like these little pink almond-shaped objects, and the fallopian tubes are connected over the top. They're not actually connected. They're very close to each other, though. And the fallopian tubes are connected to the uterus, which is a muscular organ. And you notice, you can see here when you look at her body, it's showing the uterus going up as far as her belly button. It actually doesn't quite go that far. It actually goes more like maybe halfway to your belly button. If you were to like sit down and kind of just look between like your pubic bone and your belly button, the top of your uterus probably is about halfway. It's about the size of like a small pear or a large plum. It's not that big actually, so it's pretty amazing that it can stretch to hold like, you know, 7 and 9 pound, you know, or bigger pound baby. So it's pretty incredible. And then the uterus, at the very base of the uterus is the cervix, and that is what is visible in the vagina. So like if you go and have a pap smear, they'll put a speculum in and they'll visualize the cervix and take a sample there. So, and then of course the vagina is connected to, down here at the very bottom, just above the anus, is the vaginal opening. Above that is the urethral opening, so that's where the pee comes out. And then, of course, your clitoris, which is this little tiny button here, except it's not quite so tiny as you might think. And we have the inner lips and the outer lips of the vagina, the vulva, I should say. So the vulva is the external area. Going on to the next slide, this is a side view. So up here again at the top, you see the ovaries and the fallopian tube, you know, going down to the uterus, which we only see one of the ovaries here. This is a section that's been cut away. You can see where the spine is, so that would be the sacrum and the tailbone. The rectum, so that's where your bowels are, and then of course the anus is the exit. And underneath the uterus is the bladder, and that is right in between the pubic bone and the uterus. So when you have a baby, when you're pregnant, when the baby is born, your bladder gets like majorly squished for the baby to come out. It gets squished right against your pubic bone. So, okay, and then we have the vaginal canal, and then the inner and outer lips. They're showing the clitoris going up into the tissue, and it actually is connected to the pubic bone, and I'll show you a diagram here in just a moment that demonstrates that. So here, again, is another side view. This diagram shows some different images. So again, we have the sacrum up here at the top of the image, and then the coccyx, which is the tailbone. Down at the bottom of the coccyx, you can see the pelvic floor muscles. They kind of go like a basket along the bottom of the pelvic floor. Next to the sacrum, you see the rectum, and that goes down into the anal canal and out the anus. So again, your feces will leave your body that way. The uterus is here in between the bladder and the rectum, and they're not showing the ovaries or the fallopian tubes. The cervix is a little bit shaded, a little bit darker, and that protrudes down into the vaginal canal. And let's see, what else is new in this picture? So on the bladder, if you look down around the urethra, you'll see something that's labeled as the urethral sponge. Now, this right here sometimes has been referred to as the female prostate. And if this area, if you reach inside the vagina and stroke this area, that's actually the G-spot. And you can tell it has like a different feel than once you reach inside, like the way the front of the vaginal wall feels is different. So, pleasure zone, yes. Okay, and now if you look, you see the pubic bone here, okay, and it's again attached to the pelvic floor muscles. And below that, you'll see the clitoris, okay, and we have it here labeled the clitoral head, and then the shaft, which goes up into the tissues. Now, if you look down here, you can see the faint outline of all the tissues, like the inner lips, the outer lips, and then the tissue that would be surrounding the clitoris itself. And so inside the clitoral hood, you'll have the shaft, and then it kind of takes a turn up here inside the body where you can't see it, and there's legs that extend back towards the spine. So there's actually a total of 4 legs. And, okay, in this diagram here, let's keep looking at the clitoris, which is down in your lower left-hand area. So you see the clitoral head, the shaft, and then it's like a wishbone shape. It's kind of darker. Those are 2 of the clitoral legs, and I have another image that will show you the other 2. You can see the urethral sponge, and the little red arrow here, that is showing you like where the G-spot is. And so if you stroke this area, it can definitely lead to orgasm. Depending on how much you stroke it, it can also create a buildup of fluid, and this is where the female ejaculate comes from. So, with orgasm, it is possible for women to ejaculate too. We won't be going into how to do that in this particular class, but in this image, you'll see here the pubic bone is right over the top of the clitoris, and the second, the other half, the right-hand half of the pubic bone is cut away so that we can see the organs underneath. But now underneath the clitoris is the vestibular bulbs. Now this right here is also erectile tissue. So these can be gently massaged. They're right underneath the skin and the vulva, and they will, gently kind of get poofy, kind of swell up a little bit. They won't get hard, erect like a penis, but they can definitely, the tissues can engorge, and, it places pressure on the vaginal opening, which you can see here, which is the oval shape down in between the 2 vestibular bulbs. Some people call them clitoral bulbs also. Now, underneath, in the area between the vaginal opening and the anus, there is something called the perineal sponge, and this also is erectile tissue, so this can be stimulated also and help create pleasure. In the vagina, let's see, here we see the cervix, and the opening of the cervix is called the os. That is a Greek word, O-S, so like Oscar Sam, and it means opening. And I have a picture here that I'll show you in just a little bit of the inside of the cervix, which is kind of neat. So the os, this is the opening where the baby has to come through in order to leave the uterus. So when they're talking about, like the cervix dilating, 8 inches, whatever, that's the little tiny itty-bitty hole that has to open up big enough to let that baby's head out. So, again, female body is completely and utterly amazing. Now, the yellow arrow that you see here, this is pointing to the A spot. So, up in the upper reaches of the vagina, there is tissue that, when stimulated, can result in orgasm. So that's generally referred to as the A spot. It can be difficult to reach. It can, be hard to reach with your hands, probably not possible depending on the length of your vagina. So toys or, your partner's penis, I'm sure, if you have a male partner, times where, like, in the back of the vagina, you can feel like it's, like, really good. And if he just, like, keeps doing that, it's like it'll get you there kind of thing. So that means he's stimulating the A spot. This picture here is a picture of the erect clitoris. So, again, it's not showing you the forelegs. We don't really have good drawings of the female anatomy, so it's like we put them together as best we can when we find them. So here you see, like, the pencil drawing of the outer tissue, so that'll be the outer and the inner lips, and then the hood of the clitoris. And now underneath the hood of the clitoris, you see the head, which is showing, and then the shaft, and then the bend, and it goes down into the wishbone shape. And when those are stimulated and when they're erect, they'll get thicker. Again, it's not going to be like the same hard erection as a penis would have. And the vestibular bulbs are shown here being very swollen, and then you see the openings of the vagina and the urethra. In this image here, you can see the second set of legs. So, like, there's the legs that are going around the vagina, and then you see another pair of legs that are kind of extending back, and actually you can really only see one in this image here. But this is like a sonograph. From my understanding, this is a sonograph, and I'm assuming that they colored in the parts that they wanted you to see. And so, yeah, it's just kind of cool to see. The clitoris, you can see here where it's attaching to the pubic bone, kind of like at that little piece that's going up, where the wishbone happens, that little piece that's going up. So, very cool stuff. So let's talk a little bit about the hormones. There's a delicate balance between estrogen and progesterone, and as long as those hormones are in balance, life is good. When things start to get a little wonky, then you can have a lot of symptoms. So estrogen in particular affects things like your moods, your reproductive tract. So like when you hit puberty, it's estrogen that really develops your tissues. Estrogen affects your urinary tract, it affects your heart, it affects your blood vessels, your bone health, your breast tissue, bone health. When women hit menopause, they start losing bone. So estrogen is super important. Your skin, your hair, the mucous membranes in your body and your vagina are impacted by estrogen. Your pelvic floor muscles, they can start losing their tone more easily when your estrogen levels drop. Your brain is affected by estrogen, and also your flora, so meaning like your healthy bacteria, or if you have a tendency for dysbiosis, which is the overgrowth of unhealthy bacteria, the estrogen levels can also impact that. So progesterone has a lot of effects too. So it has an effect on the endometrium of their uterus, which I'm going to show you some pictures of that in a little bit. It affects your metabolism. It affects how well your body's able to regulate your blood sugar levels. It affects your fluid balance, why some women are retaining water, one of their PMS symptoms. It can affect how well or how poorly you sleep. It has an impact on the smooth muscles and how they relax. So smooth muscles are blood vessels, your uterus, your bowels. Those come to mind off the top of my head. It impacts your sex drive. It's required for pregnancy. You cannot stay pregnant without enough progesterone. It's important for bone health, breast health, heart health, and normal blood clotting. So lots of things here. every month a woman's body goes through this series of hormonal changes, and these hormones are impacting what is happening in your reproductive cycle. So menstruation is day 1 of your cycle. Let's just work under that assumption. And it's, because it's the most easiest thing to see. So when you start bleeding, that's day 1. And that's when your hormones are typically at their lowest, is during menstruation, especially the very first day of your period. And as your period does its thing, the hormone levels start to fluctuate a little bit. They start to change. The first one that we're going to have increasing is the follicle-stimulating hormone. And what that does is it stimulates the eggs to develop. And then we're going to have luteinizing hormone, which triggers ovulation. And then it's going to be followed with estrogen. And then finally progesterone. And so the monthly cycle goes through like these different stages. We have menstruation, and then we have the pre-ovulatory phase, so your fertility is increasing at that time. We have ovulation, which is an event, and then we have the post-ovulatory period, which is non-fertile for the rest of the cycle. And once the progesterone levels drop, then we go back into menstruation. So let's take a little closer look at the ovary. So at the beginning of the cycle, up here where the little red arrow is, where it says primordial follicles, these are a little group of eggs. They're probably scattered all over the ovary, and probably both of them. But for all intensive purposes and simplicity, we're going to group them together here on this ovary, and we're going to walk you through the process as we go around the ovary. So follicle-stimulating hormone is going to stimulate this group of eggs to start developing. As they develop, the estrogen levels are going to start to rise. So you'll see here with the green arrow, and you'll see it on the hormone chart here too. So as the follicles get bigger, the estrogen levels rise. And what that does is it triggers the follicle-stimulating hormone to kind of drop off a little bit. And that sends the signal that it's time to suppress the eggs that are not fully developed and trigger ovulation, finish ripening the most ripe egg and trigger ovulation. So that's luteinizing hormone's job, is it's going to suppress all except the most developed egg, and then it's going to cause that one to finish ripening and release from the ovary. So that's going to be the luteinizing hormone spike, which is pointed out here with the black arrows. Now, after ovulation happens, what's going to happen is there's a little injury left on the ovary where the egg was. So there's a little hole. And so the progesterone and, the luteinizing hormone, the follicle-stimulating hormone, they have caused the injury to transform into something called the corpus luteum. And the job of this is, the corpus luteum is to produce progesterone. It's its entire function, its sole purpose. And so it will produce progesterone until it hits the peak, and if fertilization does not occur that cycle, the message isn't received, and at some point the corpus luteum is just going to heal over, and that's what happens. And so the progesterone levels fall, menstruation happens. Now let's go in a little bit deeper here. The whole entire system is controlled by the hypothalamus, which is an organ in your brain, a gland in your brain, and that sends gonadotropin-releasing hormone to the anterior pituitary gland. So the anterior pituitary gland has a front and a back, and it's kind of like two lobes. And this little picture here, I think it kind of looks a little bit like a little scrotum here. But this is a little tiny gland that's in the center of your brain, and it's like a master controller as far as your cycle goes. So once it gets the message from the hypothalamus, it's going to start producing follicle-stimulating hormone. So you see here in number 2, where it's acting on the ovary. And as the ovary begins to develop, it starts producing the estrogen, like I was saying. And so it's sending, as the estrogen levels rise, it's, your brain is being exposed. And so at a certain point, there's like a switch that goes off and says, okay, we got a lot of estrogen circulating here. Things are good. I think we can release that egg. Let's turn down the follicle-stimulating hormone. And so that's number 4. So we're getting the message. And number 5 is to trigger the luteinizing hormone. So there's a surge of the LH, and that, like I said, causes the suppression of any but the most developed eggs. And sometimes, there are twins that come from different eggs, so occasionally more than one egg will mature. If there is going to be a second egg, it usually either erupts at the same time or it could be like within 12 hours or so. So they're going to happen, pretty close together, because this is where the hormones, it's all controlled by the hormones. And so you have to have those conditions present in order for it to happen. So number 6, of course, is ovulation being triggered. So let's go on to the next slide here, because I want to kind of go in a little bit deeper here. So when ovulation happens, I want to bring it together. So you got the glands doing their things. You got action happening here in the ovary. It starts with the green arrow and goes, in this picture, counterclockwise. Ovulation happens here with the red arrow. You see it here in both of the images. Once ovulation happens, the egg is kind of floating around in the uterine cavity. Of course, it's close to the fallopian tube, but it's just kind of floating there. And the fallopian tube has these like little tiny finger-like projections that are on the end of it, and they kind of sweep the egg inside the tube. And so if that doesn't happen, how there can be ectopic pregnancies, well, sometimes those happen in the tubes, but they can also happen anywhere outside of the uterus. And so that means it could happen in the abdominal cavity, like if the egg falls down or something like that and doesn't get scooped up and a sperm happens to fall out there and find it. You just never know what can happen. But in general, the egg gets scooped up, goes down the fallopian tube just like it's supposed to. So the last part of the cycle is after ovulation, the luteinizing hormone causes the formation of the corpus luteum, and that produces progesterone and a little bit of estrogen too. But it's mostly producing progesterone, and you can see here in the little hormone chart where there's like a little bump in the estrogen, which is in red, and then the green, which is the progesterone, is very, very high. If fertilization occurs, then the corpus luteum will stay. It'll persist. And we're going to talk about what happens in the body when fertilization occurs, but we're going to save that for a little bit here. So I just wanted to show you how it all fits together, okay? So day 1 is menstruation here on the left side of your screen, and then we have the little tiny eggs, and they start to develop. Now, as the hormones are doing their thing, so, when the hormones are low, we have the breakdown of the menstrual phase. And then the proliferative phase is when the estrogen levels are starting to rise. It's starting to wake up the uterine tissue. It's starting to fluff up a little bit and just kind of get ready for the next stage. Ovulation happens, and then progesterone is released. Now, if you notice, there's quite a big difference between the post-ovulatory endometrium and the pre-ovulatory endometrium. So let's talk about that. So progesterone, what it's doing, and this is why if you don't have enough progesterone, a pregnancy can't survive. Progesterone just really makes the endometrium go crazy rich with just be like a nutrient rich place for a freshly fertilized egg to like nestle in and make its home for the next 9 months. So its job is to make sure that there's adequate blood supply. So if you look here towards the end, you can see that there's bigger blood vessels that are coming in. Now, when ovulation doesn't occur, these tissues are going to break down and slough off, and so that's what's causing the bleeding, is all this tissue falling away, and it's leaving these little blood vessels exposed, that type of thing. So great way to kind of clear out the whole system and flush it out. Nature knows exactly what she's doing. So a couple things to know about ovulation. Ovulation occurs about 12 to 24 hours after the luteinizing hormone spike. The egg is capable of fertilization for between 12 and 24 hours, give or take. So something that we're going to talk about is sperm longevity, because this is really important, and we're going to talk about cervical fluids and how they support sperm longevity. So if somebody wants to use natural methods to avoid getting pregnant, this little piece of information right here is a life changer, okay? And I'll just explain, really quick, and I'll show you in the image that has the cervix in it. But basically what happens is, I'm going to save it. Okay, so if double ovulation occurs, a situation where twins could happen, twins that are coming from separate eggs, not the same egg, then double ovulation will usually occur either at the time of ovulation or within 12 hours. Now, there's different kinds of cervical mucus, and it's directly impacted by estrogen. The non-fertile mucus acts as a barrier to sperm. It's very acidic. Our vagina is supposed to be acidic. It's what helps keep the bad bacteria out, and the healthy bacteria, the lactobacilli, that type of stuff, growing. So we want it to be acidic. So in an acidic environment, sperm tend to die within 3 hours. It prevents sperm from entering the uterus, and if you were to taste it, it tastes more salty and has a sharper flavor than the fertile mucus. Now, fertile mucus is more alkaline, so it allows the sperm to survive longer. I've heard the typical, quote-unquote, is 3 days. Well, I know a lot of people who have had sperm that lived for more than 3 days. So if you're trying to avoid getting pregnant and somebody tells you sperm only lives for 3 days, I'm going to say it really depends on your body. Like if you have like zero fertile mucus, then it's going to have a hard time surviving. But if you do produce, cervical mucus, which the most of us do when we're fertile, there could be surgeries that impact that kind of thing, and there might be reasons that women don't, but in general. I personally have run into sperm that has survived for a week. I chart my cycle, so I keep track of all that stuff, and I'm pretty familiar with my body and all that good stuff. And I've even heard stories where sperm can survive up to 10 days. I'm a little more skeptical about that, but I think in the right conditions with really healthy sperm, a week is possible. 5 days is probably more typical, maybe 3, I don't know. For somebody like me avoiding getting pregnant is really important. I would never give myself 3 days of a buffer. That's not enough time for me to feel comfortable. So the fertile mucus is going to be stretchy, clear, watery. It's going to change as the estrogen levels change, and its job is to help the sperm reach the uterus and ultimately the egg. So let's talk a little bit about the mucus. I want to kind of give you an up-close look at this. So the amount of estrogen is going to determine, the consistency and the quality of the cervical fluids. At the beginning of your cycle, your estrogen levels, of course, are low, and so your cervical fluids are going to be, there won't be much of it. They're going to be sticky. If you do find it, it's going to be white. It's going to be thick. It's going to be opaque. In the image, somebody's trying to to stretch it here, and, you can't stretch it very far. There's just no elasticity to it. So those are pointed out with the red arrows in the hormone image. So you're likely to see mucus that looks like that in the latter part of the cycle. And as the estrogen levels increase, if you want to look at the yellow arrow, as the estrogen levels increase, you'll notice the mucus gets thinner, it gets more watery, it's maybe cloudy, maybe there's some clearness to it, maybe it looks a little more watery, it's easier to stretch. And then finally, peak cervical mucus is like, it looks like water, it looks like egg white, and you can stretch it. And sometimes you can stretch it a long ways. And in the sperm little photo there, you can see how the fibers in the cervical mucus just align and help the sperm swim towards their goal. And their goal is your cervix. So the cervix is like the safe zone for sperm. Once they get in the cervix, they're out of the hostile, acidic environment of the vagina. And they can hang out in this area for, I don't know, I'm going to say up to a week. And if they happen to get, like if you look on the lower right-hand side where their little red arrow is, you'll see a little sperm there. And this is the blow-up of one of the cervical crypts, which are, in this pink area here, are these little feathery-looking shapes. They call those the cervical crypts. And their job is to produce cervical mucus and also they provide a nice place for sperm to hang out and wait for the egg, too. So it's kind of like a sperm coffee lounge or something. I don't know. I'm just kidding. But so the green arrow shows the blow-up in the lower right-hand corner that has the red arrow in it. So that's just a blow-up of the cervical crypt. The blue arrow is pointing to the os. So that's the opening of the cervix. Now, for women who have had a pap smear, this is the area that they're sampling. The surface of the cervix, which is below, kind of like that rounded shape extending away. And then they'll also kind of like go up into the cervical canal a little bit and collect a sample there too. In this image, you'll see the mucus is all coming down, and you probably, I don't know if you can see or not, but these little dots here that the orange arrow is pointing to are little sperms swimming up into the cervical crypts. And all the way through where the pink arrow is, this is pointing to the inner os, which is like a trap door and protects the uterus from the outside world. It clearly lets sperm through, but it's not really letting through other things. And so that's a way for your uterus to stay healthy, is to control access. The little yellow arrow down here at the bottom is pointing to an Nabothian cyst. And, that would show up like if you were having a pap smear or you had a plastic speculum and you looked in with a mirror and a flashlight, it would look like a little bump. It can be different sizes. Like I had a pea-sized one on my cervix. And they're harmless. They're just there. They don't do anything. They have mucus in them, but they don't really do anything or change. I haven't looked lately to see if it's still there, but okay. So cervical fluids after ovulation. Again, they're going to be thick and sticky. And the os closes. Your primary hormone is progesterone. And once the progesterone levels drop, then you're going to have menstruation. So the progesterone levels are dropping because the corpus luteum has healed over. The progesterone levels went down, and the uterus can no longer sustain that rich, lush endometrium, and there was no egg, so it's like, oh, so sad. So time to release the endometrium and wait for the next cycle. Now, sometimes menstruation is late. It can be for lots of reasons. Some of the more common ones are travel, illness, stress in particular, and sometimes your cycle can just throw you a curveball out of the blue for no reason that you can figure out, that I can figure out. It's just one of those things. And, it happens. Even for women who've had, like, super, super regular cycles. And, of course, pregnancy can result in late menstruation. It could be a reason for late menstruation. If you're not pregnant and your period is late, one of my favorite remedies for addressing that is parsley tea. And what you can do is you can just go to the grocery store. I prefer organic. Get a bunch of parsley. Every grocery store pretty much has it. Take it home, boil a quart of water, rinse off your parsley, put it into a jar, like a canning jar, and then just pour your boiled water over the top. Let it steep for 20, 30 minutes, and then drink that. You can strain out the herbs. Drink that, a cup at a time, maybe up to 4 cups a day for up to 3 days. It's only, I think, once ever taken me 3 days to get my period started. Usually it happens by the next day. And if you're pregnant, it's not going to work. It's not, something that can cause a pregnancy to miscarry. So let's talk a little bit about tracking your cycle. So I think every, young woman, every woman should at least do the basics, which is track the first day of your period. Use a calendar or an app or something like that. Just be aware, if you're going to use an app, that there are period trackers and then there are, like, fertility trackers. The period trackers are based on a system of averages. You may have heard of something called the rhythm method. The rhythm method is an educated guess based on your history, your cycle history. And so period trackers are going to be using a computerized version, which is probably more accurate than the paper calendar human attempt, version of it. But still, when you are making contraceptive decisions based on historical data, you run the risk of having one of those unexpected curveballs come and throw a monkey wrench into your plans. Now, when ovulation is delayed and it happens at a time you don't expect, if you engage in unprotected sex, you could become pregnant. And so when I teach natural birth control methods, I have a couple of methods that I employ to help women determine that, yes, ovulation did happen, and now I'm not fertile until, for the rest of my cycle. So having those tools to confirm ovulation, super helpful, super helpful. Let's see, just want to look at my notes here. Make a note when you have sex. And if you are somebody who doesn't always use contraception or uses different kinds or does different things during a cycle, make like a coding system so that you can keep track of what you're doing. That way you can look back. Sometimes it's helpful. Write down any symptoms that you might be experiencing, like, maybe you get breast tenderness before your period or something like that. And, just write down any symptoms that you tend to notice over time. And you may find, like, on day 18 of my cycle, I always get a headache, and then you can take proactive steps on, like, what can you do to, on day, 16, 17, et cetera, to help prevent getting a headache, from taking you out or whatever the case may be, whatever your personal situation is. So in step 2, when we get together again for the workshop, I'm going to go into, like, teaching basal body temperature, the cervical mucus, cervical changes in particular. That was a really big one for me because when you look at your cervix, you can actually see the changes that it goes through when you're fertile, when you're not fertile. So it can be a really great way of getting real information. Of course, The cervix isn't necessarily easy to see because it's up located inside you, so I will definitely teach you how to do all of that. And then finally, there's hormonal changes that, you can track. There's devices, there are tests, there are different ways to do it. And so we're just going to go really deep into all of that stuff. I know not everybody is interested in that, so that's why I wanted to pull it out and have it be separate, because it's an amazing skill set to learn. And, some of this is available in books. Like there's a fantastic book on basal body temperature, and it includes stuff on the cervical mucus too, that's taking charge of your fertility. Great book. Didn't exist when I was learning. Came along afterwards. But yeah, I was like, damn, I should have wrote that book. So anyway, so we'll go deep into all of those different methods, and also we'll talk about the herbs and that kind of stuff too, but that's something separate from tracking your cycle. So tips for living in harmony with your cycle. When you know when you're fertile, when to expect menstruation, you can kind of plan your life around that. Like, for example, for many years I had really intense, awful cramps during the first day of my period. And this was, for many years, this was back in my 20s. And it just would really just take me down to the ground. And so what I started doing was I started rearranging my lifestyle a little bit around my cycle. So when I was expecting my period, I did my best to, try to have a home day and just kind of do things I enjoy, nurture myself, don't plan a heavy schedule. So if I'm tired or not feeling well, I can go with it. It's like I can just go with the flow. And when I'm ovulating, for example, my energy levels are up, I'm more outgoing, I feel more upbeat, I feel more social. It's so that would be a great time to plan events, if you're going to go for a job interview or hit your boss up for a raise, go when you're fertile, you're ovulating, because it's estrogen is this sexy hormone. It's just women glow, and we exude pheromones. People pick up on it, it's all good stuff. So you can kind of play with that and really just support your body in what you need to be happy and healthy. If you decide to learn the natural birth control methods, then, like I said before, it's you're only fertile during certain times of your cycle. The trick is figuring out when. And because ovulation is not set in stone, you need to figure out when that happens. And once it's happened, you're not fertile for the rest of the cycle. So, spontaneous sex, plan your date night, whatever, it's you won't be fertile for the rest of the cycle, which is great. And, guys, if your lady struggles with PMS or, symptoms that have to do with her cycle, there's things that you can do to let her know that she's loved and appreciated and take the burden off of certain things. You could cook dinner, you can clean up the house a little bit, or give her a back rub, a foot rub, bring her some tea, ask her what she needs right now, how can I support you on this day or whatever. And so, so just, being kind and considerate and supportive. And because I know some women do have a really hard time with PMS, mood swings, it can be a little crazy. And so doing things along this line can help earn you some brownie points for when you do go the wrong way and do something to piss her off or whatever. So let's talk a little bit about herbs and nutrients for cycle balance. Oat straw, nettles, linden flowers, comfrey, red clover, and this group of 5 herbs are just amazing to cycle through. If you have cycle issues, just these 5 herbs can do so much good for your body. The oat straw and the nettles are very, very nutrient-dense herbs. The linden flowers, those are great. Red clover, it kind of helps balance your hormones. Comfrey is just full of nutrients. If you have some challenges around, like with your uterus, like say, for example, intense cramps, raspberry leaf is a uterine tonic. A lot of women who are going to get pregnant will use raspberry leaf to help tone the uterus, to make birth easier for them. Wild yam root, I found, is so helpful for cramp. I actually used wild yam for a period of time in my 20s and found it just helped my cramps so much. It was amazing. Motherwort is great for stress. Parsley is great for a late period. It's just a couple of, vitamins and minerals off the top of my head. Minerals are important, especially magnesium. If you're craving chocolate, you probably need some additional magnesium. If you're having a lot of problems with PMS, the essential fatty acid, GLA, can be really helpful for you too. And B vitamins are super helpful too, especially if you have a lot of stress. One other thing I just want to mention really quickly is some people don't process their B vitamins very well. There are a lot of genetic mutations around the B vitamins, and so if you don't feel good when you take Bs, if you happen to have a blood test that includes B vitamins and those levels are high, there's other symptoms too that you can tell in the blood work, but it's kind of beyond the scope of this call. You might have a genetic mutation that prevents you from absorbing things like folic acid and some of the other B vitamins, and that can cause problems too, especially if you've been exposed to something like HPV. So at some point, condoms are going to come off, whether that is you got married and you decide to have babies, or you get sick of condoms and say you go with your partner to get STD testing and you've got a clean bill of health, et cetera, et cetera. The two main concerns when the condoms come off are, one, increased risk of pregnancy, and two, even if you have testing, they still can be at risk for STDs. And let's just talk about that really fast. So every year, there's almost 20 million new cases of STDs, and the bulk of those are from HPV, the human papillomavirus. Now, what this chart doesn't say, and I'm going to go out on a limb here and make an assumption, because we aren't normally testing men for HPV, we'll talk about this in a second, there's not really a test available as far as the medical establishment is concerned. So what that means to me, and again, I'm making an assumption here, that probably these 14 million new diagnoses of human papillomavirus are women who are getting abnormal pap smears, because that's where they're testing for HPV. So that means that the number is actually probably double that, because men get this virus too. So it's pretty serious here. Now let's just take a look at HPV-related cancers, okay? We have known, at least since the 70s, maybe even the 60s, that HPV is associated with cervical cancer. We have screening now, which is pap smears. So women are generally encouraged to get an annual, or sometimes they're spaced out a little further, pap smear in order to look for cervical cancer or signs of the cervix being adversely affected by the human papillomavirus. The majority of cervical cancers, the majority of abnormal pap smears are from the human papillomavirus, which is sexually transmitted. In this diagram here, it breaks down how the different types of HPV, I'm not going to get into that, but what is particularly concerning about this chart is you look at the men and you see how many guys are being diagnosed with oral and throat cancer. It's almost the same number as women being diagnosed with cervical cancer. And we're screening for cervical cancer. We're not screening consistently for oral or throat cancer. So this is a big problem. And it's pretty scary. I mean, if you look, too, like the women, they are at higher risk for anal cancer than they are the throat cancer. And, vaginal cancer is very low. It's about the same as penile cancer, a little bit higher for penile cancer. But, so yeah, HPV is concerning. Now, if you were doing all the right things and you go take a new partner to get standard STD testing and you ask for everything, this is the selections that they can give you. What you'll notice is not on here is HPV. And I went to Planned Parenthood's website just to update my information, just to make sure I'm telling you correctly. They only can look for genital warts, so that's a visual exam. And then down here in the red box, high-risk HPV, no HPV test for men. And women can get tested through samples from their cervix, which means the pap smear. Now look at this. It's just crazy stuff. They did a study. This is the, sponsored through a branch of the CDC. And HPV is like everywhere. About 45% of men tested positive for HPV, any strain, and 1 in 4 tested positive for high risk. For women, it was 40%, and 1 in 5 women were testing positive for high risk. This is crazy stuff. And they have it broken down here by race. These are just averages that I'm giving you right now. And oral HPV, this is a problem too. 11% of men, with 6.8% being positive for high risk, and then 3% of oral HPV, this is any strain, and then 1 to 2% are, testing positive for high risk. So men in particular, they need to be aware of HPV and how it affects the oral cavity, the throat, and the mouth. So here's how to protect yourself, okay? It used to be we could only ask questions, and asking questions isn't going to get you good information. It'll get you some information. But now we do have a new FDA-approved test that you can use at home. There's 2 different versions of this test. You can get the high risk, which will ID 16 and 18, and then a pool of 12 high-risk strains. And then there's also full HPV genotype testing, which is the kind I had done recently. And they check 49 different strands of HPV and find out exactly which strands you have, both high risk and low risk, so you can be proactive about your health, because there's a lot of stuff that you can do to fight HPV naturally. So it's a do-it-yourself kit. It's super easy to use. My boyfriend and I both did them. It took 2 minutes, literally. If you test positive, what if? It's not the end of the world. I know it's a sexually transmitted disease. It can be horribly embarrassing, but here's the thing. 14 million, I'm going to say women, are being diagnosed every single year. You are not alone. There is, I'm sure, an equal number of men who are acquiring the virus too. It's like, you feel uncomfortable and self-conscious, but you know what? The person standing next to you, if you were to strike up a conversation about HPV, there's a good chance that they know a thing about it too. So think about HPV as it's a virus. So let's think about it as the flu, for example, okay? Your cervix has a cold, your cervix has the flu. When an adult gets the flu, they get sick for a little while, they get better. If a young child or an elderly or somebody who has a compromised immune system gets the flu, it can get worse. It can progress to pneumonia. The person could die. It's chances are they're just going to get sick and get better. It's just the flu. It's not that big of a deal, but there is a small segment of the population, especially those who don't have good immune systems, are going to have problems. You can also think of it like chickenpox. So there's confusion around HPV. They're saying two different things. So they're saying that about 80% of the sexually active population acquires HPV in their lifetime. The majority of infections are transient. You know, your immune system fights them off. You probably never even know that you have the virus. And then the other scenario is that it can persist. It can hide out in the tissues, and it might lie dormant and not do anything, or it may keep causing you problems kind of thing. So it can go either way. So let's, for the sake of this particular example, let's say that it goes dormant. You had the infection. It went dormant. Maybe it messed with your cervix. Maybe it didn't. Either way, it doesn't matter. You were exposed at some point. Now, like with chickenpox, you know, most of us get it as a kid. And then when we grow up, when we get elderly, when our immune system is compromised, et cetera, it can come back as shingles. Not fun. Well, HPV is a little bit like that too. For the people who it persists in during times of stress or when you're not taking care of yourself or abusing yourself, et cetera, it can rear its ugly head again, especially if your immune system is depressed. Stress really does seem to be something that will cause problems with it. If you've been diagnosed, disclose it to your partner. It is part of your sexual history now because it can hide out in the tissues. We don't know if you can clear it for sure. I'm super excited about the testing because maybe that will shed more light on some of these questions that we have. So I'm very excited about the new test. When you've been diagnosed with HPV, it's an invitation to take extra good care of your health, the place that your spirit resides, your physical house, your body. And I tend to think of when you have been exposed to HPV, your cervix, if you're a woman, tends to be like the canary in the coal mine. So if things are not going real well, if you're running out of oxygen, the canary is going to die first. So if your immune system isn't doing well and it's having a hard time with HPV, it's going to affect your cervix. And that, like I said, is an invitation for you to take better care of your health. So again, I'm just going to take a quick peek for questions, and then we'll dive into the last section here. What is the best method for achieving G-spot and A-spot type orgasms on our own, using our own fingers or a toy? Is it true that it's not a good idea to use vibrators as it can make it harder to achieve orgasm on your own? Okay, well, first question, what is the best method? So for G-spot stimulation, if you're doing it on your own, 2 fingers in the vagina and kind of like a come here motion, you might want to start with like stimulating your clitoris and then some of the outer tissues and the labia, and then move into the G-spot after, you know, you've had a little bit of stimulation. If you go straight for the G-spot, some women do find that uncomfortable. That's like too much, too fast kind of thing. The female body requires being warmed up. Like, you just can't flip the on switch for most of us. Like, sex kind of starts in our brain. It's like our partners can, like, get us turned on when we're at work by sending us sexy, suggestive text messages and, like, kind of build that energy for when we get home kind of thing. It's like, it's real hard to just kind of, like, jump into bed and be like, okay, I'm moist, I'm juicy, I'm ready to go. It's like, yeah, that just doesn't really happen unless we've been kind of fantasizing in our mind first a little bit, anticipating that type of thing. For A-spot, a tool is probably going to be your best bet. You can use a vibrator. There's something else called a TheraWand, and that's it's like a curved wand, and that can get in the back and, you know, stimulate those areas, reach those points, that type of thing. And, you know, just play around, see what's best, you know, what works best for you. I don't think, unless you have very long fingers, you probably won't be able to reach the A-spot. So a toy of some sort would be good for that. And it doesn't have to be a vibrator. It could just be a dildo-shaped object and plenty of lube, and play around, see what feels good. And then as far as whether or not it's a good idea to use a vibrator, I'm a fan of mixing it up, so let your fingers do the walking sometimes. Mix it up, use different vibrators, try different things. I mean, if you do the same thing over and over, then you're just kind of training that pathway, that neurological pathway. And so by stimulating other areas, that will help keep your pathways like branching out and stuff. And I also, actually, I forgot to mention too, you know, the nipples are also erectile tissue, so it can be very good to stimulate them too. Stimulate the girls. Let's see. Another question here, do women need to use lubrication after a certain age, or can we always produce enough juice for intercourse? Well, that's a great question, and it's one of those things where gotta use it or lose it kind of thing. If you go through long periods of time where you're not stimulating the vagina, it can be harder, especially after menopause, to get those juices flowing. But if you are engaging sexually either by yourself or with a partner and, you know, having those juices, having that stimulation, then it makes it easier to produce your own fluids. You know, every woman is different. Every body is different. And I would say definitely play around. Use good organic lube, because some of the lubes can have some really nasty stuff in them. So, but there's some really good organic ones out there. Like Yes is out of England. There's Good Clean Love. They're nice. Let's see, what else is there? There's I think Orgasmic Blossom or something like that. I can't quite remember the name. Aloe vera, that's another really good one. That's made with an aloe vera base, so that could be good. Let's see. Next question. So cervical mucus, you discussed, is different from what gets secreted when we're in a state of arousal. Yes, different, very different. So arousal fluid, and how you can tell the difference between the two is the cervical mucus is going to be there when you're fertile. The arousal fluid will come when you're aroused, obviously. But also, I wouldn't check for cervical mucus when you're aroused, because that can make it confusing. But arousal fluid has a higher water content. So, like, when you have arousal fluid on your finger, it will evaporate more quickly than if you have fertile mucus on your finger. The fertile mucus is going to take a long time to dry, and depending on what stage of fertility you're in, it could stay moist for a long time. Okay, so name for the wand, it's called a Thera, Thera wand. So Thera, so Thera wand. And if you can't find it, email me, and I'll find a link for you. All right, so let's go back to the slides. So the other thing that can happen when the condoms come off, of course, is pregnancy. So let's talk a little bit about the biology of it, because I find it actually quite fascinating, and I'm sure you will too. I don't want to spend a lot of time on symptoms of pregnancy. You can Google that. There's tons. But some of the more common ones are nausea, the tender, swollen breasts. And I also want to just point out there are times when swollen, tender breasts, even if it's not what's normal for you, is not related to pregnancy. Sometimes it can just happen. I can't explain why. You know, it's like, I don't know what's going on in your body. But I've also had this happen out of the blue. It's like, damn, my boobs hurt. It's like, what the hell? Pregnancy test is negative, all that good stuff. Something else I'll mention here at the bottom of the list, and we're going to talk about this more in step 2 in the workshop, is during pregnancy, the basal body temperature, which is measuring your resting body temperature, and you can use that to confirm the passage of ovulation. It doesn't give you any warning of approaching ovulation, but it's definitely a very powerful tool, easy to use, to confirm the passage of ovulation. And then once you've done that, then, you know, you're non-fertile for the rest of your cycle. And like I said, you know, you can learn it, you know, from a book. If you get training, like if you attend my workshop, it's like you're going to know everything by the time you're done. But just for real quick here, the basal body temperature when conception occurs, because there's increase in progesterone levels, like the corpus luteum doesn't die off. It actually goes into high gear. And so the additional progesterone is going to cause your resting body temperature to rise. And so we will, in the next workshop, we're going to look at that, what that looks like, talk about all those details. So let's talk about what happens when pregnancy occurs. Now, we talked about the sperm hiding out in the cervical crypts. They can swim up into the uterus. They're going to swim into the fallopian tube. Fertilization actually happens in the fallopian tubes. And it takes about 5 days for the fertilized egg to make its journey down into the uterus and implant on the uterine wall. So once fertilization occurs, once ovulation occurs, 5 days. If it doesn't happen, if fertilization doesn't happen in that 12 or 24-hour window, then the egg breaks down and it just washes away in the menstrual fluid. You'll never know it's there. So when fertilization occurs, you may remember this from biology class, the egg starts to divide. It divides again and again and again. And finally, the blastocyst is what implants on the uterine wall, and it happens day 5 to 6. Something really cool is when a woman is pregnant, inside her baby's developing ovary is your granddaughter's egg. So it's like your generation number 1, your unborn baby is generation number 2, and her daughter is generation number 3. So you've got 2 generations that you're taking care of in your womb when you're pregnant. And the things that you do during pregnancy are going to impact not only your baby, but your grandbaby too. So it's kind of cool. Something good to know. Unintended pregnancy is still a big problem in the United States. There's about 54% of the pregnancies were not planned. The reason that that's happening is mostly because people are just not using birth control for whatever reason. Sometimes birth control sucks. People don't want to put hormones in their body. I didn't. Another reason why people are not using condoms consistently or incorrectly, and that's another 43%. With the 52% that are not using birth control, I mean, that could be different things. One, they just don't have a method they like. Maybe they don't have sex very often, and it just happened, and they weren't expecting it. I mean, there could be tons of different reasons, but when you're using birth control, there's actually a very low risk of getting pregnant. Only 5% of people who have gotten pregnant experience birth control failure. It does definitely happen for sure, but these other reasons are the main reasons why unintended pregnancy is happening at these levels. And with education, like if people came to this class that you're here right now and the one that I'm going to do on July 2nd, it would change everything. It's like once you learn this stuff, it's like it's almost impossible not to know, at least have some sort of sense where you are in your cycle. So, and the closer attention you pay, the easier it is to tell, that kind of thing. But even if you don't pay that much attention, the information that your body sends you is there's quite a bit of it. All right, so let's move on. What do you do if there's a broken condom or you get swept away in the heat of the moment, birth control failure? I have a whole chart that I go through with my clients who are doing the whole natural birth control thing and learning the different methods and that kind of thing. But I just kind of wanted to give you a quick summary and some of it without the information from the training that's going to happen on the 22nd. On the 2nd. Some of it might not be 100% usable, but if you've had an exposure to sperm and you are concerned that you might be fertile, Here's some different questions to ask yourself. Do you keep notes on your calendar? Did you mark down day one? How long are your cycles normally? You know, you can count backward and use like the rhythm method math to kind of gauge your risk type thing. One key question is, are your cycles regular or irregular? If they're regular, going by the math type thing, you know, using the reverse engineering, basically the rhythm method to identify when you probably would have ovulated if you ovulated according to your history or whatever, like your typical patterns. If you don't keep notes or your cycles are irregular, then monitoring your basal body temperature can give you important insights into where you are in your cycle. If your temperatures are on the low side, you're probably pre-ovulation. If they're on the higher side, it's probably post-ovulation. And when I say lower and higher, this is actually a very narrow band of temperature range. We're talking tenths of a degree. And so somebody actually needs to like have a little bit of history, like do this for a cycle or two just to like know what's normal for you. And then in the future you can go back and like, you know, use that information, you know, take your temperature for a couple days in a row, try to see if you can figure out, you know, my pre-ovulatory, my post-ovulatory, you know, where am I in my cycle? Did I conceive? Was my temperature extra elevated? What exactly is going on? Looking at the cervix can also help you determine if signs of fertility are present. And again, you know, having the experience of watching your cervix go through the cycle will be very helpful in using this as a tool in order to determine whether you should use emergency contraception or what you should do. Other factors that can decrease the risk of conception, you know, what contraceptives to use. I mean, over the years, I have come into contact with so many teenagers who are freaking out over having sex lots of times for the first time. And it doesn't matter that they used a condom. It doesn't matter that they were on the pill or whatever the scenario might be. It's just the fact that they had sex and they're freaking out. So one of my first questions when I come into contact with somebody like that is, were you using any contraception? And sometimes they were. So again, that's going to decrease your risk. It doesn't mean that you're out of the woods necessarily, but definitely decreases your risk. Did ejaculation occur inside or outside of the vagina? This is going to determine your risk of conception. Again, I'm thinking of all the questions that I've gotten from teenagers over the years. And can I get pregnant in the pool? You know, if he ejaculated on the outside of my underwear, can I get pregnant? You know, all these questions. The next important question is, does exposure occur during a fertile time in your cycle? If you come and join me for the workshop, then you will have that information. You'll be able to figure that out. And then, you know, did they use emergency contraceptions? Do they want to? So how long ago did sperm exposure occur? If it was been within 8 hours, if you happen to have wild carrot seeds on hand, you can use that as emergency contraceptive or as an herbal contraceptive. If you are within 36 hours, you can use emergency contraceptives like Plan B. You can get these from the grocery store. If it's within 72 hours of exposure, the Plan B type pills that you can get off the shelf are not quite as effective as emergency contraceptive called Ella, which is more costly. You have to get a prescription, this type of thing. But it is more effective than Plan B once you get past the 32 hours. Also, you can use a copper IUD during this time as well. And in theory, you can use the copper IUD up until the point of where the egg actually implants on the uterine wall. In general, they'll only say, you know, you can use it, 5 days after it happens, but just based on physiology of implantation, we know it takes 5 days for the egg to go down and implant once it's been fertilized. The semen could, in theory, be in the cervical crypts for up to a week. So let's just call it 5 days. So there's a span of like 9 days or so between when you were exposed to the sperm and when it actually implants in the uterine wall. So copper IUD, definitely within 72 hours, can be effective, and possibly even longer, depending on how well you know your cycle and what's going on with it. If you are a week after exposure, consider using the basal body temperature method, which, we will definitely get into more on the workshop. And if you aren't going to attend the workshop, you can pick up a book about it, that type of thing. So, again, once implantation occurs, you're going to have, most people will have a spike in temperature, and that signals that the corpus luteum is in overdrive and producing progesterone to support a pregnancy. So if you're 2 weeks past exposure, take a pregnancy test. If it's negative, you can take another one a week later. If your pregnancy tests are negative 21 days after exposure, then conception did not occur, even if you still don't have your period. This is just the numbers. Like, if your period is 21 days late, you've been exposed to sperm 21 days ago, at that point, from that exposure, a pregnancy test is going to be positive. So something else is going on, but it's not pregnancy. Time is of the essence if you have been exposed to sperm and you are worried about unintended pregnancy. So go quickly, run to your store and get what you need. Or call your doctor. Okay, so let me see if there's any more questions. All right. Okay, we got a bunch of questions here. Okay, is it normal to have daily secretions? For some women, yes. Actually, there is always some degree of secretion. Even when you're non-fertile, you're still producing, there's still moisture, there's still mucus being produced. There's less of it, but there is still. And everybody's different. What's normal for me might not be normal for you. Some women have more secretions than others. Some women have bacterial imbalances, dysbiosis. Maybe there's yeast, or maybe there's bacteria that shouldn't be there, and maybe that causes additional issues. But a lot of times those will come with an odor, or you'll know something else is going on too. So if all seems normal, and it probably is, it's totally good. And when you chart your cycle, like if you were to go through the workshop and apply everything that you learn and actually chart your cycle after the workshop and do it for a couple months, it'll give you a sense of you'll figure out okay, this is what my mucus looks like when I'm fertile. This is what my mucus looks like, when I'm not fertile. This is what it looks like as my fertility is increasing. And you'll get familiar with the changes. And, for me, it was just one of the most empowering things that I ever did for myself was to learn how to monitor, to manage my fertility without having to rely on birth control pills, which that's where I started my after my mom put me on the pill at 15, I just stayed on the pill until I was 20. And at that point, I just didn't even know, what to do or how to get off the pill, how to protect myself. And so yeah, when you're on the pill, too, that is going to, really dry up your secretions, too. So, again, every woman is different. Every woman, you just have to figure out what's normal for you. That's really what it comes down to. Can a woman squirt on her own? If so, what is the method? Well, it's stimulating the G-spot, and with enough stimulation, the fluid builds up, that type of thing. I'm not an expert on female ejaculation. I have not had the opportunity to do that. I don't think. I'm not sure exactly, so I'm still exploring my body and seeing what it's capable of doing, too. Am I a fan of jade egg, the yoni egg practice? I think it's great. It exercises your vaginal muscles. No reason not to do it, assuming that you're using, high-quality eggs that aren't minerals that will cause problems for you. Do you recommend women do daily Kegels? Not exactly. I do believe in taking care of your pelvic health. It's super important. And Kegels can be really helpful for some people. But if you have imbalances in your pelvic floor, like, for example, like if you have a really strong muscle and a weak muscle and, you're trying to exercise the weak muscle, but, a lot of times it's going to be the strong muscle is the one that's getting the exercise unless you're able to, like, isolate the weak muscle and really do specific exercises to strengthen that one. So if you have a problem where there's an imbalance in the pelvic floor like that, then when you're exercising your Kegel muscles, you can create greater imbalance because those muscles are getting stronger and the weak ones aren't able to engage because, your brain doesn't have a strong connection to those muscles. So doing things like vaginal massage can help you, and like flexing those muscles a little bit while you're doing vaginal massage. You just use your thumbs or whatever. Or you could use the Thera wand and do massage to help your brain, like, identify where those muscles are. And you can practice, like, doing little tiny flexes or squeezes to see if you can, like, get those muscles to move, like, in each area of your vagina. Let's see, just a couple more questions. Do condoms, latex and or polysporine upset the vaginal pH? I find after sex it feels off in my yoni. Well, if your partner, if you have a male partner and he's ejaculating in your vagina, that definitely changes pH. It raises your pH levels because semen is alkaline, because sperm need an alkaline environment to survive. So it will definitely change the pH for sure. And then as far as like the condoms, I don't really think of them as changing the pH of the environment. The real way to find out is to test, get some pH paper that will go into the lower ranges, like the 3.0, 4.5, that type of thing, and see what happens after sex. And again, the arousal fluid is going to alter the pH a little bit, but in general, the pH is pretty low. If it feels off afterwards, I don't know if you're sensitive maybe to the condom material, or maybe need more lubrication, or I'm not sure. Play around and see. All right, so I'm going to dive back into the slides here so we can finish up. So I just want to do a quick recap. So today we looked at, basically gave you a new view of the anatomy and physiology of the female body and also pregnancy. We took a look at the hormonal dance, the basics of tracking your cycle, a little bit about protecting yourself from HPV and HPV-related cancers, which there's a lot more to that. We just scratched the surface. It's something I'm very passionate about. It's hard for me to talk about this stuff and not at least mention it because it is such a problem. But I do have information, actually quite a bit of information on HPV, and if you have interest in learning more about that, you can just email me and I can send you some information on that. And then finally, we looked at how to, I'm going to say a light look at how to prevent unintended pregnancy if contraception fails or you get swept away in the heat of the moment. We're going to talk more about this stuff in step 2, which is your toolbox. And really what we're going to do, for those of you who want to go deeper with me, what I'd like to do is just tell you a little bit about what that would look like. Like I said, we're going to talk extensively about the natural birth control methods. I feel like the stuff that we cover today is just really important basic information in order for you to move into the next step, which is learning the techniques, learning what your body's doing, learning how to identify what is going on in your body at any given point during your cycle. So let's talk a little bit about what's going to go in your toolbox. We're going to talk about natural solutions to the birth control issue. the hormonal birth control just causes so many problems for women. It kills your libido. There can be long-term consequences. It can make you gain weight. It can make you moody. It can give you leg cramps. I mean, there's just like this huge long line of symptoms, and even some of them can be like fatal. It's like crazy stuff. And who wants to put like artificial hormones and chemicals in your body anyway? I know I didn't, and so that's what started me on this journey. And you know, I created this workshop because, like I said before, I mean, I talk to women about this stuff all the time. And whenever I start talking about this stuff, people always tell me, oh, I didn't know that. Wow, somebody should have told me that, you know. And so really I just want you to have all the pieces of information. And especially if you're a mom and you are raising kids, it's like, what a gift to be able to give your kids this information. I mean, really, it has the potential to be life-changing. So clearly, I'm very passionate about this. I could talk for days on it. Understanding your body is like the key to preventing unintended pregnancies. It's the key to having a great life, because like if you like get in a bad relationship and then you have a baby and then you're kind of stuck, and then it's so hard to like just create the life that, you know, you really could have had if you had had like that little bit of information that maybe would have changed your behavior just a little tiny bit and made all the difference in the world. So this workshop is for people, if you've ever struggled with the side effects of hormonal birth control, if you don't like putting chemicals in your body, if you hate your birth control method and you wish that there was something that actually like you liked and fit with your lifestyle and how you want to interact with your partner, this workshop's for you. If you want to get rid of the condoms or the other barrier methods, if you've had problems with late periods and irregular cycles, I know a lot of women get stressed out on a regular basis because their period is late and they're afraid that they're pregnant, even though they might be taking precautions, whatever the case may be. It still messes with your mind. It's like that little niggling fear in the back of your mind. Oh, shit, what if I just got pregnant? What if I just made a bad mistake right there, you know, kind of thing. And like I said, I talk to people all the time about this stuff. So let's talk about natural birth control methods, because, I mean, these methods are the answer. They're versatile. You can mix and match them once you learn the skills. It's like you can take shortcuts. You can combine things. You can create like this amazing way of managing your fertility that really works with your lifestyle and gives you the level of protection that you need to prevent unintended pregnancy. And for me, I've been doing this for 25 years. The last 20 years, there haven't been any pregnancies. It has been the most amazing thing I have ever done for myself. And I've had several partners over the time period, you know, the 25 years where I've been using these methods. And each relationship I've been in has different needs. One person couldn't use condoms. So we had to, like, figure it out. And having this information as my foundation just really made it easy for me to, like, go with the flow, modify things. It was great, and I highly recommend it to every woman, and especially the young women. Like, if the young women could learn this stuff when they're growing up, that would be, like, my sweet spot. I would be so happy. Okay, so other things that we're going to learn, okay. We're going to learn a scientific method of monitoring your fertility. All of these different methods are scientific. No educated guesses when it comes to fertility. It's like, no, that's a bad idea. Don't do that. There's lots of things you can do. You can make contraceptive decisions based on real-time information that your body's sending you. You'll know when it's safe to skip the condoms, and you won't have to worry about getting pregnant because you'll know with certainty that ovulation is done for the cycle. So, yeah, and like I said, we'll combine them, and we're also going to talk about herbs that, influence fertility, in particular the ones that decrease your fertility, just because I'm curious about them too. And it's going to be nice because you're going to get like a big download of information, and if you need to go back and listen to the replay, it'll be available for you. You can totally immerse yourself in the learning and the comfort and privacy of your own home, and you're going to get 25 years of accumulated knowledge about fertility awareness, natural birth control, and how you can successfully manage your cycle without the hormones. You don't have to use condoms if you don't want to. I can show you how to do this and do it in a way that you're not putting yourself for getting risk for pregnancy, unintended pregnancy. I'm going to give you a couple bonuses. One is a 60-minute interview from the time that I spent with Susan Weed. She is this incredible wise woman. She knows herbs inside and out. She's just amazing. And we sat down and we talked about the female reproductive cycle, how to balance it, what herbs are good for. It's like we talked about all kinds of stuff. And this is just going to be a great informational recording for you. I know that you're really going to enjoy it. And Susan, she's one for controversy sometimes. I don't always agree with the things that she says. She had an interesting view on paleo diets, and I was a little shocked, I have to admit, on her stance on GMO foods. It wasn't what I was expecting. And I don't know that I agree with her, but I'll let you listen, and you can make up your own mind about what she says. She does research, too. She knows her stuff, and I definitely appreciate her. She is an amazing goddess, and I'm so grateful that she took time to spend with me so that we can share with you. For the first 5 people who sign up right now, they're going to get a free, private, one-on-one coaching session with me. Now, this is a $297 value, so this is a great opportunity. We can talk about strategizing your birth control method, or I can help you with a whole range of other things too. But however I can help you, I'm totally happy to support you. So how to sign up? There's actually a button on your screen that you can use to sign up. And also, this is the link. I had to connect it to my Raising Empowered Daughters website because I was having trouble with my other website. Something wasn't set up correctly there. But so anyway, you can go to myraisingempowereddaughters.com/N for natural, B for birth, C for control workshop. So NBC workshop. And space is limited. Sign up. If this is a yes for you, jump in right now. Be one of the first 5 people. I would love to spend some one-on-one time with you. So thanks so much. I appreciate your time. Have a wonderful evening. Bye-bye.